The Refractive Cataract and Anterior Segment Fellowship is a brand new fellowship that we are introducing with EyeCare partners and specifically here at Cincinnati Eye Institute. We're trying to focus on taking people out of residency and teaching them the skills that they really need in practice to become very good surgeons and very good refractive surgeons, and teach them how to work with premium intraocular lenses, work on biometry and lens selection, talk to patients about different lenses, and really become very, very good refractive cataract surgeons in their first year. The need for the anterior segment specialty comes out of how much there is to learn and how much time you have to do it in a typical residency. There's so much more happening now in cataract surgery and different lenses and lens technologies than there was 20 years ago, yet the residency is the same amount of time. And so you're trying to cram more and more into the same space, and it's just hard to learn everything. The highlights of the fellowship are going to be working with myself primarily, as well as other specialists within our practice here in Cincinnati, learning some advanced medical retina, anterior segment reconstruction, glaucoma, as well as MIGS surgery, and then becoming a really good refractive cataract surgeon. Learning the different techniques with biometry, with formula selection, lens selection, talking to patients about lenses, and choosing the proper lens for the proper patient, so that when a fellow graduates, they're going to feel very, very comfortable jumping right into practice. What we're hoping that a fellow will get out of the fellowship here is to jumpstart their training and to put them 2 or 3 or 4 years ahead of where they would be if they had just come into practice and started practicing right out of training. So we'd like to get a fellow in 1 year to a point where they're performing like they would be 3 years into practice. And really try to jumpstart those couple of years. Doing that makes the year of training really valuable. If you can jump in and already feel comfortable with multifocal lenses and light adjustable lenses and toric lenses, and really hit the ground running in practice, becomes a really valuable thing, and gets a good return on that 1 year time investment that a fellow is making. To someone considering the fellowship, I would say it's a year of your training. It's a year of career, and that's a very important year, and we're very cognizant of that. And I want to make sure that the fellow gets a great return for that year, and that when they're finished with the year here, that they are really ready to start practicing at a very high level, much higher than they would be if they had just spent a year in practice learning by themselves.